Hello friends, I am Dr. Harsh Mathur from Om Netralay, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended, not meant for children. And in this case, we will be discussing about how to manage a soft cataract, which is easy and as well as repeatable. So, in this case, we will be doing a hydroprolapse and tilt one pole of the nucleus out of the bag and then chop it. So basically we'll be doing a supracapsular phaco. So many surgeons prefer a pre-chopper. Some go for stop and chop, some go for divide and conquer, and some go for direct chop. But these soft nuclei are very difficult to hold. Chopping is very difficult as the cheese wire, and making a trench, one needs to be very careful so as not to go very deep and puncture the capsule. So every surgeon wants to find a way which is safe, easy and repeatable. And this tilt and chop technique, doing a supracapsular phaco, I find it easier to manage the soft nuclei, and this is repeatable. And with good care, we are able to keep the endothelium safe. So the prerequisite is to make at least a 5.25 to 5.5 mm of rhexis. It was a 5.5 mm marker, and which will help me guide my rhexis. So with a bent cystotome, just following the curve, the rhexis is done, and we have got a fairly round rhexis. Now to hydroprolapse, the trick is to first get a good wave so as to clear the nucleus. Gently tap it, and from the other end keep pushing the fluid slowly, keep pushing, and slowly the nucleus will tumble out. So to get this one pole of the nucleus out, one needs to get at least a 5.25 mm of rhexis. Do not try to hydroprolapse the nucleus in a very small rhexis. Now the cornea is coated with viscoelastic substance for better visibility. Trying to bring the nucleus in a position where I am comfortable with. The endothelium has been coated with a good OVD to protect it. And now is the time to take the probe inside. Make sure not to overfill the OVD and push the nucleus back in the bag again. So now the probe is taken inside. The central endonucleus is held firmly, and the dialer goes behind the nucleus, and we are able to propagate a chop quite easily, and in no time the nucleus is divided into two heminuclei. Now with least amount of phaco power whenever needed, most of the nucleus goes with just vacuum, and slowly but steadily we are emulsifying the heavy nucleus. And now is the time to manage the second heminuclei. Goes out in no time, and that's it. We have managed the nucleus in less than a minute. So with a good OVD coating the endothelium, though we are working in the supracapsular region, but as the nucleus is very soft, we don't have to put in a lot of phaco power. So this method is pretty safe, not only to the endothelium but also to the posterior capsule. So this method is easily repeatable. In one of the videos I have also shown if the whole nucleus doesn't come out, what to be done. So in that case we do a hydrodelineation and prolapse the endonucleus, and rest of the epinucleus and cortex can then be easily managed. The video's link I'll share at the end. In the end screen you can watch that also. So a hydrophobic lens is being implanted. The leading haptic goes in the bag and the trailing haptic is then dialed in. Now we need to remove the OVD from behind the IOL. Gently nudge the IOL forwards and the Simcoe cannula goes behind the IOL. The rhexis is nicely overlapping the optic, which will give us a good centration. And that's it. Now is the time to close the wounds. So the take-home message is: find a method which is repeatable in cases of soft cataracts, as soft cataracts are the hardest to conquer, but I find this method quite easy and repeatable. I hope you like this video. Do it next time. Thanks for watching.